Bonjour, je suis Etche Noel. Je suis cofondateur de OPISMS et je suis heureux d'être ici. Je voudrais pour cela remercier le professeur Benamou et aussi
I would like to thank Professor Benamou as well as the representatives of the Pierre Fabre Drug Company. I'd like to start my presentation with three reminders.
Okay. Monsieur Koulibaly.
First of all, Mr. Koulibaly is a financial expert, financial advisor. And he supported us, he helped us in our project because he did the accounting of our project for free. Mr. Koulibaly is disabled. He had polio when he was young. And he said that if he'd had help before I was born, he would not have had this problem. So polio affected his lower limbs, and he moves around with a crutch. And then this is Trésor. He was very gravely ill and had to be hospitalized for 5 days. Luckily, he made it, but his mother came to us to talk about his case just after his disease. Aya, this is her doll. Aya fell seriously ill. Unfortunately, we were unable to save her. She died of measles, and her doll is now orphaned. And just like Aya, close to 100,000 children die every year because of lack of vaccination. They die mostly of measles, and that's not normal. That has led the government to apply a broader vaccination program, but 46% of those that are not immunized are not immunized because they lack motivation, 16% because of lack of information or ignorance, 38% owing to problems or obstacles in relation to the vaccination program. Here's a news program about the Abidjan startup OPISMS, an electronic vaccination record which sends you an SMS reminder of when it's time to immunize your child. 100,000 users, and this is just a beginning. Elodie Dogo is a young mother. Her daughter is just 6 weeks old. Today, she's preparing for a very important medical visit, the vaccination of her daughter. I need to access, says the nurse, the child's health record, and I just open the bag and get the telephone. And indeed, that telephone is a precious instrument because the mother received a text message a few days ago. The message says that the visit is to be scheduled today, Monday. It's very important for young mothers because this helps them really stick to the vaccination schedule. This is not a government-sponsored program. This requires a subscription from a private company, 1,000 CFA francs per year. The young mother takes her child to the Abobo hospital, a mandatory step for all mothers in this community near Abidjan. There are 2 free initial injections after birth. And after being logged in the regular register, Elodie also shows her electronic vaccination record for her daughter. So we have the phone number, the shots the baby got today, and the schedule so that we can send her a text message for the next message. So Elodie will be born when the booster shots and next shots are scheduled. This really helps the hospital. Well, we still write down the dates of appointments for people. We used to give patients a piece of paper with the date of the appointment, but they would not come. They would forget. They would lose the appointment. But this year with the SMS service, we vaccinated a whole lot more than last year. In Côte d'Ivoire, 85% of the population receives the first shots, but the incidence rate for the booster shot is very low, creating a public health problem. At the International Vaccination Center, OPISMS opened up its first registration offices. The strategy is simple, reaching out to the patients as soon as they leave the hospital consultation. The startup launched the service in 2011 in partnership with the Ministry of Health, and it is working. With the updates and everything, we can reach up to 300 persons a day. 500,000 mothers have already opted for the electronic vaccination booklet. Something else that's impressive. All this is run by a very small team. A handful of employees run the entire service. This is the developers' room. This is where we have developers working on improving the platform. This is where customer information is logged and where the next appointments are scheduled, putting in the name of the patient. The number of subscribers is shooting upwards. 80% of the population is equipped with a cell phone, and OPISMS has designed a good technology that is adapted to the needs of the population. We realized that there was a problem with keeping up with the immunization schedule. So we thought that automating notifications using text messages would be a help. This is a private company. It has been subsidized, but it still needs to be profitable. In order to do that, it needs to attract users. The company already uses or enjoys subsidies from an NGO, but it hopes to also convince the government for public funding. Interpreter correction. There was no public funding up till now. This morning, they are meeting with the Ministry of Health. Contacts have already been made, and in 2 months, the electronic vaccination record will be launched. Here's our objective in the short and medium term: to have as many subscribers as possible, up to 1 million right now, but Côte d'Ivoire has 22 million inhabitants. So OPISMS and their team submits a number of proposals. First of all, having the service funded by the government. Yes, the population would like a free service. Everybody finds this a great service, but when we say it's 1,000 CFA francs a year, they find that very expensive. OPISMS will be sustainable if it receives government subsidies, but it is already starting to develop. It has agents, employees in 135 sites, but it wants to be present in 1,700 health centers. So today we have 700,000 subscribers. They've all used the service at least once. 577 health centers. And you see where we're present in areas with and without subsidies. Unsubsidized or green areas are places where subscribers pay 1.5 euros per year for the service. In orange, we have is where we get support from an NGO from 2011 to 2015. We got seed funding. And so these subscribers get messages for free. And with this NGO, we ran a comparative study comparing one controlled population not receiving text messages and one group same size receiving text messages. With the text messages, we got a rate of attendance of 100%. So we see the impact. It's very clear. this is our team and our various partners. Ministry of Health, that we have signed an agreement with, official agreement with, the National Institute of Public Hygiene that monitors all vaccinations. We started out with a pilot project, which is still running. Then Helen Keller International, the NGO that has supported us, for 4 years, but now has run out of funding. So we would like other NGOs to take over. Then another NGO, the Pierre Fabre Foundation and the Observatory of Health in Southern Countries that has funded our presence here today. And it's thanks to the observatory today that we're present here today, and we have spread our presence. And here are a number of useful links if you want to find out more about us. Thank you.